Well, the holidays are a time for family, friends, and traveling, but for some, the food and drinks could actually lead to a bigger problem.
Chris Bryant has more on why the so-called holiday heart could be a serious condition.
Holiday heart syndrome, while sounding like a festive name, in reality can be very troubling. It is a short-term abnormal heart rhythm and gets its name from an increase in heart patients seen this time of year.
So there are different ways that patient can present complaints to providers. So when we see them, we piece everything together and we get all the vital signs. We got, checking the heart rate, ECG, we found out that patient having these irregular heart rhythm issues. And on top of that, blood test came back showing signs of congestive heart failure.
With the causes coming from extra alcohol, extra food, and holiday stress, even those with a healthy heart can experience holiday heart syndrome. Hypertension, issues with your valves, sleep apnea, diabetes, and obesity can all increase your chances of AFib during this time of year. It is also more common in men and those older than 65.
A lot of different food that you take, salt, increase in salt intake, all that can contribute to a lot of pressure your body internally has to deal with.
And too much salt and water retention can make your heart work harder.
All cardiologists usually advise patients to take notes of their body weight, symptoms as well, just so that if they have known to have pre-existing heart condition, they are always prescribed with water pills. So the water pills help to keep up with the amount of fluid in retaining in the body. In other words, amount of stress that the heart has to handle.
Holiday heart symptoms may include heart palpitations, fatigue, shortness of breath, weakness, and chest pain. You can help prevent holiday heart syndrome by avoiding drinks with alcohol. Other things you can do include limit how much you eat, especially when it comes to salty foods. Get regular physical activity and make time to relax and manage holiday stress.
If I hear patients not complaining of any warning signs like chest pain, they check their heart rate. The heart rate is not going crazy like 150 to 180s. Anything generally, a rule of thumb for me, any heart rate below 120, it should be okay to wait and talk to the family doctors, cardiologist first before going to the emergency room, because the emergency room is going to be packed with patients, right?
If you are experiencing a medical emergency, call 911. Chris Bryant, KY3 News.